Hello, welcome to Office Hours. If this is your first time, welcome. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you are looking for, if you're confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. So today is office hours. I'm answering your questions. You have excellent questions. Thank you so much for sending them in. I always love reading them. They're always awesome. And today we're going to do a deep dive on several of them. So let's get started. If you have a question afterwards, you can definitely leave it in the comment section down below, or if it's on a particular video, you can leave it on that video. I'll find it. And let's get started. As a caveat, I can't answer personal medical questions because I'm not your personal physician. But so if any question leans a little personal, I'm going to change it a little bit so it's more broadly applicable to everybody from an educational standpoint. So, with that said, let's get started. Today's first question is, why can't I find any videos on severe body aches and hip pain as the main side effects to this? This is about a GLP-1 agonist, I believe. Okay. Why can't you? Well, I gotta say, I don't think it's a very common side effect. Certainly not one that I hear about a lot in clinic. If anything, patients, as they lose weight, a lot of times their body aches and pains get a lot better. So, because weight, there's a couple ways to think about weight. Weight is both gravitational or mechanical stress on the body and endocrine inflammatory stress on the body. So, weight loss improves both of those. So, a lot of times when patients start these medications, they lose weight. So, a lot of that mechanical gravitational stress is lifted off their joints. And these medications also seem to have a kind of anti-inflammatory property to them. So sometimes what will happen is if somebody also has, let's say, psoriatic arthritis, that gets a lot better too. And that's something that we're learning more and more about as more people are on these medications. So somebody coming to me and saying, hey, I started this medication, I have more body aches and pains, is unexpected. But however, we do know that people are not textbooks. And so not everybody's going to fit perfectly the expected set of side effects that they have from a medication. So is this unusual? Yes. Is it outside the realm of possibility? Absolutely not. And I've talked about this before in some videos on insomnia and weight loss. And these medications, a lot of times that gets better, but every so often it gets worse. And the same can be said for actually the side effect of, or the intended effect of weight loss overall. Most people are going to lose weight on these medications, but every so often there's somebody who doesn't lose any weight, and some people actually gain a few pounds. Is that rare? Yes. It is definitely not something that happens a lot at all, but is it outside the realm of possibility? No. So, with that being said, of course, it is well within the range of possibilities for somebody to have increased body aches and pain on this medication as well, although it's not what I would expect. So for anybody who's having that, my deepest sympathies, because that's not the goal. Also, check and see what you're on. And interesting to note, like if you've tried Zepbound, if you've tried Wegovy, if you've tried Saxenda, did you notice a difference between any of those? Also, I am definitely not a fan of compounded medications for weight loss. And you can see my video about that. I'll link it down below, the illegal Ozempic video. But also, this is also the time to check like, ooh, if I am on a compounded medication, the problem is that you can never be certain you know exactly what's in it because it hasn't undergone the testing that say a medication like Zepbound or an FDA approved and regulated medication has gone through. So if that's you, just double, you may want to think about not being on a compounded version if that's possible. I always recommend it. You For anybody who's on a compounded medication and they're having strange side effects, I don't recommend the compounded medications, but this is another reason why I don't think they're a solution, because if there are these unintended side effects, you don't really know exactly what you're getting. So, buyer beware. Okay. What else? You definitely, anybody who's coming to me and feeling like they're having these unintended consequences of body aches or hip pain, I'm always going to rule out other things. Can you have something else going on in addition to just starting a medication? Yes. So it's important to always make sure you know what you're dealing with. So if someone came to me with this, I'm also going to look for all the other reasons that they might have body aches or hip related pain. I'm definitely telling them to stay hydrated, make sure they're, also if they're having a lot of fatigue from the medication, the fatigue is definitely something that's more common. And sometimes body aches can feel like fatigue. So that would be something that I would counsel a patient to check in on as well. And then also to see, like, do a little, data collection for that patient. Like, is this happening the day after your injection? Is this happening 2 days after your injection? Does it matter? Is it at all time related? Is it all related to the dose? Did it happen after you went up on the dose? And it's always a lot of these side effects tend to go away with time or can happen just in the very early stages of when you are starting the medication. So that's something for anybody who's experiencing this to be aware of as well, is that there's always a time component for a lot of people as well. Okay, so that's a great question. Next question. This is about the Mounjaro Forever video. Hi, doctor. I know this is a peptide. Can you talk about other peptides that help for weight loss? I am so glad you asked, because peptide is really just kind of a marketing gimmick for these medications. So people will talk about, like, I'm on this weight loss peptide, or, this peptide versus that peptide. All it means is tirzepatide, semaglutide, liraglutide. Something like phentermine is not a peptide. It is a much smaller compound, much smaller molecule. It is not made of strings of amino acids. A peptide, at its scientific core, is a substance that's made up of linked amino acids, and there are about 20 amino acids in our body. They are the building blocks of life. And so a peptide is a linked chain of amino acids. And if you have a very, very long linked chain of amino acids, you have a polypeptide, which is also called a protein. So a peptide is just really a shorter protein. And, but it sounds, I think from like a marketing standpoint, it sounds like way more interesting if you're on a weight loss peptide than if you're on like Mounjaro. And I think probably that's how some of the compounded medications are, framed as well. But really it's just semantics. So yes, I can talk about them, and I have talked about them. So I would definitely recommend checking out the videos on liraglutide, and which is also called Saxenda, and semaglutide, which is also called Wegovy or Ozempic, and then tirzepatide, which is also called Mounjaro and Zepbound. So I have lots of videos on all those medications, and peptide is just another way of referring to those injectable GLP-1 agonist medications. So great clarifying question for everybody. That's usually what people mean when they're talking about like a weight loss peptide. Okay, so next question. This is about the video Zepbound. Did your Zepbound stop working? Okay, this is very depressing because I am way over X amount of pounds and I am X feet tall. I need to lose a lot more than the 18 pounds that I've lost on Mounjaro 2.5. I started Mounjaro 5 milligrams 3 days ago. The scale hasn't budged. Okay, I'm going to make this little, I'm going to depersonalize this one a little. For anybody who's on Mounjaro or Zepbound 2.5, also we'll just go by tirzepatide, 2.5 or 5. That is a very, very low dose of the medication. The medication goes all the way up to 15. And if I start somebody on that medication, I'm fully intending that we are going to go all the way up to the highest dose, because we know that the dose response of the medication, it's dose dependent. So the higher up you go, the more weight you lose. I'm always going to make an exception for those people, those outliers on the bell curve who they start it and they lose like a ton of weight and they reach their goal before they even get to that highest dose. So for safety reasons, I don't go up for those patients, but they are definitely in the minority, and usually my plan, because of how the medication works, is to go all the way up to 15. So if I have somebody on 2.5 or 5 and they are not losing weight or they are plateauing, that's not the end of the world. That is kind of how it works. You know, usually the weight loss, it's not going to be a nice, clean downward trajectory. It's going to go like, if people are losing weight, it's usually like, and then there's a little, you know, it's not perfectly linear, and there's many different factors for that. But I would never, if somebody came to me and they were like, I am not losing a lot of weight on this low dose, I am not surprised, because they're also on a pretty low dose. So that's just, you know, kind of, you know, they're just in the beginning phase of their, you know, weight loss journey on this medication. And so it's not a big red flag for me. So definitely if somebody really hasn't lost about 5% of their total body weight and it's been about 3 to 4 months, that's usually where I will reconsider. That's where, you know, generally you would say, this medication isn't working at all, and do we want to go up further? Usually I will, because especially if there are, if insurance is okay with it and will continue to pay for it, I will, because in those cases, sometimes there is a competing medication. And so sometimes you don't get a really good response until you go up to the higher dose, but it's very patient dependent. And all this is to say that if someone hasn't lost all their weight on the first 1 or 2 increments of this medication, I'm not surprised, and it doesn't mean that it's not working. So for those people out there, hang in there, keep chatting with your physician who's prescribing this for you, and just don't despair. Excellent question. Okay, next is this is about Phentermine. My doctor prescribed 15 milligrams. I'm on high blood pressure meds and a little nervous to start taking the medication. Okay, you're smart. So just again, to depersonalize this, so Phentermine is a stimulant. And so one of the side effects of stimulant medications is they can increase blood pressure and they can increase heart rate. Now, does this mean that Phentermine is contraindicated for anybody who's on high blood pressure medications? Absolutely not. It would be contraindicated if someone had a heart arrhythmia, like I'm never going to put anybody who has AFib or another, SVT. I'm just not going to mess around and put them on Phentermine. But if someone is on a blood pressure medication and their blood pressure is well controlled and Phentermine otherwise seems like a really good fit for them, I mean, it's always a patient physician conversation in terms of what someone's comfortable with, but it's definitely within the realm of, medications that could be used. Your blood pressure, the patient's blood pressure just has to be well controlled before you start it. And they have to be watching it to make sure it doesn't go up while they're on it. So again, thank you for this question, because this is a great teaching moment as to why it's so important to be monitored while you're on these medications. I do worry about people who are not being, well supervised on the medications. It's not like a drive-through, throw some meds out the window and then you take them and keep going. No. You need to be monitored and have a physician checking in with you while you're on these medications, because they are prescription medications. They are serious. They have serious side effects, and high blood pressure is one of the ones that you definitely want to be on the lookout for if you are starting something like Phentermine. Even if you don't have high blood pressure to start, if you are taking Phentermine, it's important that somebody is taking a look, is monitoring your blood pressure while you are on this medication to make sure that it's not going too high. So all that is to say, bottom line is, if someone has a blood pressure if they're on high blood pressure medication and it's well controlled, usually Phentermine would not be a hard stop. Usually Phentermine would not be contraindicated for that patient, but it's always a physician-patient conversation as well. So what a great question. What a great point. Thank you so much for asking that. All right. What happens on a consult call? Oh, great. I'm delighted you asked about this. So for those of you who don't know, I posted a video last week that I am now able to help people outside of Massachusetts through my work as a life coach. So I work as a physician, as you know, but I'm also certified as a life coach, and it's just another way that I can help people with their weight in a different modality that's also very helpful for weight control. So so through my life coaching, I work with people to help fix the one big thing that's coming between them and their next weight loss goal. And so the consult call is incredibly valuable. It's not scary. It's complimentary, meaning it's free. And also we spend 45 minutes going over your mental roadblocks that are popping up. So either way, by the end of that call, you are walking away with a roadmap of what your key problem areas are and what you need to get started on to help fix them, regardless of whether we are working together or not. So I want this to be really productive time for you. So either way, you are walking away with something that's incredibly helpful and valuable. So I think it's a no-brainer. For those that are interested, grab a spot. I've linked the scheduling link below. I would love to talk to you. This is my favorite thing to talk to people about. So, and it's not scary at all. So we'll chat. You'll get some good takeaways and we'll go from there. Okay, so I'm going to link all the videos that I talked about down below. Excellent questions. Thank you so much for all the questions. If your question was not answered today, don't worry. It's on the list. I'm going to get to it. And if you have questions after this, please leave them. I love answering your questions. Thank you so much for watching, and please be well.